Continuation, bone marrow transplant process. So here we will prepare the donor as well as the recipient by doing all the diagnostic measures, followed by harvesting from the donor, conditioning the recipient, filtering the harvested bone marrow, cryopreservation of the harvested bone marrow, infusion or transplantation of the bone marrow, followed by the neutrophilic phase, which is faced by the recipient, and engraftment period, which is happening in the recipient. So these are the process we will study one by one. First one is harvesting. Harvesting can be done by two methods. Bone marrow can be harvested. The peripheral stem cells can be harvested. So the bone marrow harvesting is an invasive procedure which is done with special needles, Jamshedi needles as well as Klima needle. So mainly we are using iliac crest and rarely we are using sternum. What we are using is we are aspirating the bone marrow directly. So for this, the donor have to lie down in prone position. It is done under general anesthesia. It may take 1 to 2 hours to complete. Special needles should use. Stem cell as well as blood are aspirated. It may take 2 to 3 skin punches to do the procedure. Bandage will be applying after the procedure. At the site of the aspiration, the donor will experience pain. The donor's body will replenish the removed bone marrow in few weeks. So we are taking some of the bone marrow from the donor. So that taken bone marrow will be replenished after after some weeks. Next, peripheral stem cell harvest. So it's mainly obtained from the peripheral blood in an outpatient procedure. Okay, the blood is being collected from the patient and it will go through a machine. And the machine will do a process called apheresis. Apheresis means separating the only needed cells. The other part of the blood will be returned back to the body. Okay, so here we will be only selecting the stem cells. So it may take 2 to 4 hours. So here the in our normal blood circulation, we are having fewer stem cells in the circulation. Okay, so in order to increase the amount of stem cells in the circulation, we can do chemotherapy as well as growth factor injection, granulocyte macrophage colony stimulating factor injections. So these injections will help to mobilize the stem cells from the bone marrow. So sometimes the patient have to undergo this drug before the peripheral stem cell harvest. In case of bone marrow stem cell harvest, this procedure is not needed because we are directly aspirating from the bone marrow. So after growth factor injection or chemotherapy, stem cells can be harvested from 4th or 5th day. Continuing with the conditioning regimen. So conditioning is done for these things. So conditioning means we are providing chemotherapy or radiation therapy or combined therapy before infusion, before transplantation of the bone marrow. Okay, so this is the conditioning means we are providing treatment, cancer treatment to the patient before bone marrow infusion or transplantation. So the treatment can go for 7 to 10 days. Why we are doing this treatment means we have to destroy the malignant cells. We have to create room for the stem cell to grow. So after this treatment, we are infusing the or transplanting the bone marrow. So bone marrow need room to grow back. Okay, or it will suppress the immune system. So if you are giving the treatment, it will suppress the immune system so that the new cells will be accepted. If the immune system is not suppressed, what will happen? Graft versus host disease can occur because it is a transplantation. So this can be achieved by chemotherapy, radiotherapy, or a combination. So conditioning can be done in two ways. ablative treatment or reduced intensity treatment. Ablative treatment means aggressive treatment. A high dose of chemo, radiation, or both is being given to the patient. Reduced intensity treatment is only done in older patients or with other health problems. A lower dose of chemo and radiation is being given. So ablative treatment as well as reduced intensity treatment. Followed by filtering. So after harvesting, we will follow by filtering. After aspiration, the bone marrow from the donor is being filtered and processed to strain out the bone fragments. After that, we can preserve the bone marrow. Otherwise, we can transplant. After filtering, we can directly infuse to the patient, or it can be stored with cryopreservation for later usage. Here we are studying bone marrow transplantation. We have studied liver, we have heard about liver transplantation, heart transplantation, etc. In that cases, what is happening? A heart is being replaced. In bone marrow transplantation, what is happening? Bone marrow is being aspirated and it is being infused back to the patient's body. Hope you understood the difference. So after infusion, the stem cells will travel through the blood and it will reach to the bone marrow and it will produce new bone marrow cells. The stem cells are delivered to bloodstream usually through an IV infusion, similar to blood transfusion, and no surgery is needed. So this is a transplantation we are doing and without a surgery. Next is neutropenic phase. So I have already told you that conditioning is being done. That is, we are giving chemotherapy or whatever treatment which is decided for the cancer. So after this treatment, what will happen? Almost all the immunity will be losing, the malignant cells will die, as well as it will create new room for stem cell. So here, as a part of this, about 2 to 4 weeks, the patient will be in neutropenic phase. Absolute neutrophil count will be 0, indicative of no immune activity. The patient has no effective immunity. That means the patient is very susceptible to infection. Patient should be in neutropenic ICU. Strict care should be given. Empirical antibiotic therapy should be started. Supportive care should be given in order to prevent this. When this phase will be there? Okay, think. We have harvested bone marrow from a donor. We have filtered the bone marrow, and we have given this bone marrow to a patient. So before receiving the bone marrow, the patient will always undergo the chemotherapy or radiation or whatever treatment which is planned for him. So after the treatment, the patient will be having no immunity. During this phase, we are giving the bone marrow to the patient. Bone marrow, what we have harvested. So this bone marrow stem cells will travel through the circulation and it will reach to the bones. It will go inside the bone. It will start producing new bone marrow cells. All of a sudden, this will not happen. It will take much time for this process. So about 2 to 4 weeks, the patient completely will be in neutropenic phase. Okay. Engraftment. So engraftment means what I told just now. The time which take the stem cells moves from the circulation to the bone and start producing new cells. So engraftment of stem cells take place when the donated cells make way to the bone marrow and begin reproducing new blood cells in the patient. So depending on the type of transplantation and the condition of the patient, the engraftment time can be more than 15 days or 15 to 30 days or more than that. Blood counts will be performed frequently to evaluate initiation and progress of engraftment. Whether engraftment is occurring normally, we have to check in between, we have to perform blood counts.